RICE is a mnemonic for 4 elements used to treat soft tissue injuries, which is an acronym for rest, ice, compression and elevation. The mnemonic was introduced by Gabe Mirkin in Sportsmedicine Book in year 1978. RICE is considered a first-aid treatment, rather than a cure for soft tissue injuries. The aim is to manage discomfort and internal bleeding. Primary 4 terms: rest. Rest is a key component of repairing the body. Without rest, continual strain is placed on the affected area, leading to increased inflammation, pain, and possible further injury. Additionally, some soft tissue injuries will take longer to heal without rest. There is also a risk of abnormal repair or chronic inflammation resulting from a failure to rest. In general, the period of rest should be long enough that the patient is able to use the affected limb with the majority of function restored and pain essentially gone. Ice. Ice is excellent at reducing the inflammatory response and pain associated with heat generated by increased blood flow and/or blood loss. A good method is apply ice for 20 minutes of each hour. Other recommendations are an alternation of ice and no ice for 15–20 minutes each, for a 24–48 hour period. To prevent localized ischemia or frostbite to the skin, it is recommended that the ice be placed within a towel or other insulating material before wrapping around the area. Exceeding the recommended time for ice application may be detrimental, as it has been shown to delay healing. Compression. Compression aims to reduce the edematous swelling that results from the inflammatory process. Although some swelling is inevitable, too much swelling results in significant loss of function, excessive pain and eventual slowing of blood flow through vessel restriction. An elastic bandage, rather than a firm plastic bandage, is required. Usage of a tight, non-elastic bandage will result in reduction of adequate blood flow, potentially causing ischemia. The fit should be snug so as to not move freely, but still allow expansion for when muscles contract and fill with blood. Compression stockings or sleeves are a viable option to manage swelling of extremities with graduated compression. These garments are especially effective post-operatively and are used in virtually all hospitals to manage acute or chronic swelling, such as congestive heart failure. Elevation. Elevation aims to reduce swelling by increasing venous return of blood to the systemic circulation. This will result in less edema, which reduces pain. Variations. Variations of the acronym are sometimes used, to emphasize additional steps that should be taken. These include RICE hydration, ibuprofen, rest, ice, compression, and elevation, price protection, rest, ice, compression, and elevation, price pulse, rest, ice, compression, and elevation, prices protection, rest, ice, compression, elevation, and support, prints protection, rest, ice, NSAIDs, compression, and elevation, RICE rest, ice, compression, elevation, and referral, DRICE diagnosis, rest, ice, compression, and elevation, police protection, optimal loading, ice, compression, and elevation, alternatives. As RICE and its variations work by reducing blood flow to the injured area, some people argue that for certain types of injuries a protocol that increases blood flow, such as MED, should be used instead. Another alternative measure, HEM, suggests increasing healthy blood flow to the ankle, including immune cells required for healing. The treatment also suggests improving healthy range of motion, stability and strength in the ankle to aid in a full recovery. Recent research suggests that macrophages are necessary for muscle to grow back to its pre-injured state. This requires healthy blood flow, but since it has been suggested that, when ice is applied to a body part for a prolonged period, nearby lymphatic vessels begin to dramatically increase their permeability. As lymphatic permeability is enhanced, large amounts of fluid begin to pour from the lymphatics in the wrong direction, unregistered trademark, increasing the amount of local swelling and pressure and potentially contributing to greater pain. As a result, the HEM ankle rehab treatment suggests not icing the injury, and instead, following more proactive rehab techniques for recovery. See also, cold compression therapy, references. External links.